Fistula in ano, termed as a Nassor-E Maqad in Arabic medicine, presents as a challenging perineal pathology, necessitating a robust experimental framework for the comprehensive inquiry. This investigation endeavors to establish an induced fistula in ano model in New Zealand white rabbits. This type of study is first time in the world as well as in India. Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr.Syed Shakoor Bukhari, presently doing MD in Unani at Govt Nizamia Tibbi College, Charminar, Hyderabad in Department of Pharmacology. I have been selected by the Ministry of Ayush, Government of India, from Department of Ayush J&K as an in-service candidate. Let us start what is fistula. As we know, my study is concerned with the inducing fistula in ano, which is simply establishing a rabbit model for perineal fistula. Males are more involved in this disease as compared to the females. A cohort study has revealed higher prevalence of fistula in among males under 16 years of age, predominantly when with a disease's duration of less than a year, especially among men. One out of every five patients with an anorectal abscess are prone to develop this type of disease. Now, if we see the fistula formation showed a strong association with the inflammatory bowel disease like Crohn's disease is there. Some surgical interventions are there, systemic hypertension, diabetes mellitus, and all that. Incidence rates varied by gender and discussed with males exhibiting a higher rate compared to the females. Why we did this type of study? Presently, what studies are available regarding the induction of fistula ano as a preclinical study, such as rats are there, rodents are there, pig model is there, although there is also this rabbit model is there, but the complexity of a perianal fistula in humans making it difficult to test therapies or understand disease progression. Need of a new model is just simply to seek fulfill the gap of this research to develop an induced fistula in unknown white rabbits with the objective of enhancing comprehension of perianal disease pathogenesis and exploring novel therapeutic modalities. Given the absence of universally efficacious and complication-free treatment, the development of innovation therapeutic approach is imperative. Hence, the creation of an optimal animal model capable of stimulating persistent anal fistulas with a lesion resembling clinical manifestation is vital for the preclinical investigation in this domain. Types of fistula. If we see the types of fistula, there are four main types of a fistula. Number one is intrasphincteric fistula. Number two is transsphincteric fistula, suprasphincteric fistula, extrasphincteric fistula. These type of fistula are more common in this disease. Why we choose these type of animals for our study? The anatomical position, the sphincteric area and the lower GI area is very easily to explore. Anatomical perianal region is closely resembling to the human anatomy, making it very good to have induction of the fistula in nano, and the cost factor is definitely there, and the handling of these animals are very concerned. Overall, the establishment of the rabbit fistula in nano model offers a promising platform for further research into anal fistula. These rabbits are accommodated in a controlled environment devoid of pathogens, featuring hygienic surroundings, appropriate lighting and ventilation facilities. Indoor conditions were regulated to maintain the temperature ranging of 24 to 28 degrees Celsius, alongside a relevant humidity level between 50 and 70%, ensuring exposure to 12 hours of light per day. Formally feeding and unhindered access to water were provided to the rabbit on the day preceding and the day of a surgical intervention. A mandatory 7 days acclimatization period within the enclosures preceding the commencement of experimental procedures. The weight of the rabbits were meticulously documented on the day of a surgical intervention, subsequently at the 7 days of interval, totaling 6 distinct time points. The experimental cohort was stratified into the intervention group denoted as A and B. The induction of perianal fistula was achieved through a minor surgical intervention conducted under the influence of general anesthesia. Regular daily assessments were conducted to ensure their well-being. Simply, the process of a clinical assessment involves careful observation. Perianal disease activity index score was simply using to confirm fistula formation. You can appreciate that this is the pictures which have been taken after the induction of 20 days. This picture is after 20 days of induction of fistula in ano. This is 40 days of induction of a fistula in ano. And this X-ray has been taken after 14 days of a induction of a fistula in ano. The man Whitney U test shows that there is no significant difference in scoring between groups A and B. That is first day, 10th day, and 20 days. However, when 20 days lesion and the 40 days lesion were graded or compared using non-parametric tests, it indicates that there is a statistical significance difference in the grading of perianal fistula. The 20 days induction period and the 40 days induction period having a significant difference as far as the fistula formation is concerned. Furthermore, it is noteworthy that the rabbits allocated to the group B exhibit a more conspicuous manifestation of a fistula formation, characterized by the discernible epithelialization, granulation, and fiber tissue proliferation. 40 days post-induction, in contrast to the comparatively subdued outcomes observed in Group A. These empirical observations collectively infer the superiority of employed modeling in contrast to the methodological approach adopted in Group A. Histological examinations was conducted subsequently to the conclusion of the experimental phase. If we see the histological examination or histological images were analyzed for manual visual assessment of ulcers, like lymphocytes is there, neutrophils are there, fibrosis, recessions and edema. Blind analysis was performed by an expert on these slides. The ulcer was observed in both groups, 20 days and 40 days, but it was less pronounced in group B, which could be due to the recovery granulation, the inflammation, cells, neutrophils, and lymphocytes, and the edema were present in both groups without major differences. The chronic inflammatory response, fibrosis, and recession was much more pronounced in group B compared to the group A. The differentiative point is the prominent fistula formation is there. What we get that we have successfully created fistula in ano after 40 days of induction with epithelialization without any chemical use. If we see the histological examination, the difference between group A and group B was simply epithelialization, the inflammation. In group A, the inflammation was more there, and in group B, the inflammation was less, but epithelialization was more there. So the key discussion points is simply challenging in diagnostic and treatment. Only available treatment is surgical intervention, but the recurrence rate is very high. Another thing is diagnostic tools. What diagnostic tools are available? The recurrence rate remains a critical issue. Long-term vigilance and the continued management, like we have to prevent the infection, the complications of fistula will be less. Ongoing research is essential to optimize treatments with a focus on reducing recurrence and improving long-term outcomes. Clinical challenge in fistula is simply surgical decision making remains complex with no consensus on optimal approach to cryptogranular fistula. The introduction of a novel technique has not fully resolved the challenges. As we know, there are so many treatments are available nowadays, but the complete treatment in a satisfactory of fistula is not there. Doing all this consciousness to all these challenges, we can create chemical-free preclinical model, the surgical suturing steel wire gauge number 18 for fistula induction in a rabbits avoid us to use any chemical agent. What was the research finding? The prolonged stimulus using surgical suturing steel wire led to the better disease outcome. Histopathological examination, what it reveals simply the formation of a fistula in ano was good, was complete, was well developed in 40 days of induction period as compared to 20 days of induction period. Conclusion of this study is we have successfully developed fistula in ano without any chemical use in New Zealand white rabbits after 40-day induction period. This model is first time in India as well as in the world. This model effectively mimics human perineal fistula formation, allowing us for having the parameters like perianal disease activity index score. Number 2 was ultrasound perianal region, third was X-ray fistulogram, and fourth was histopathological examination of the fistula of perianal region of the New Zealand white rabbits. Research implications is simply the model offers a robust platform to exploring innovative therapeutic strategies aimed to advancing the treatment of perianal diseases. Thank you very much. I thank all the jury, all the selectors of International Research Excellence and Best Paper Awards who selected me for this award. I also thank my institution, all dears and nears who supported me a lot and my department for this award. Thank you very much.